About 7,700 years ago, in what is now Siberia, someone buried a young woman beside two infants. Archaeologists studying the grave noticed something deeply unsettling. One infant appeared to be positioned feet first. The other was trapped behind it. The evidence suggests a catastrophic birth complication, a situation that, without urgent medical help, may have left no possible escape. It is one of the oldest well-documented archaeological cases connected to death during childbirth, and for most of human history, it was not an unimaginable tragedy. It was a risk built into being human. No hospital, no surgery, no blood transfusion, no emergency team waiting behind a door. Just a mother, a newborn, and a body attempting one of the most difficult things any mammal body can do. So how did humans survive childbirth at all? How did generation after generation make it through one of nature's most dangerous transitions long before modern medicine existed? The answer begins with an uncomfortable truth. Human birth is unusually difficult. Compared with many other mammals, human babies arrive with large heads, broad shoulders, and brains that still have enormous amounts of growing left to do. Human mothers, meanwhile, give birth through a pelvis that must do far more than allow birth. It must support the organs. It must connect the upper body to the legs. It must help us walk upright. It must carry the weight of movement across long distances. And somehow, through the center of all that, a baby must pass. For decades, scientists explained this through an idea called the obstetric dilemma. The argument was simple. Our ancestors evolved to walk upright. Walking on two legs changed the shape of the pelvis. At the same time, human brains were becoming larger. Larger brains meant larger infant heads. And suddenly, evolution faced two competing demands: a pelvis suited to upright movement, and a birth canal wide enough for a large-headed baby. The baby had to fit through a narrow, twisting path. And human birth became difficult because neither side could fully win. It is a powerful idea. But today, scientists know the full story is more complicated. Some researchers argue that walking upright may not require a pelvis as narrow as people once assumed. Others point to the limits of a mother's metabolism, the energy demands of pregnancy, the shape of the pelvic floor, body size, climate, and the long evolutionary history humans share with other primates. In other words, there may not be one single reason human birth is hard. There may be many. Evolution did not create a perfect solution. It created a compromise. And every human being begins life inside that compromise. The mechanics of birth reveal just how strange that compromise is. The human birth canal is not a straight tunnel. Its entrance and exit have different shapes. As a baby moves through it, the head usually has to rotate. Then the shoulders must rotate too. By the end, the newborn is often facing away from the mother. For a long time, scientists thought this backward-facing birth was completely unique to humans. But later observations showed that chimpanzee births can involve similar rotations. The mystery was not solved. It became deeper. Humans may not be the only primates with rotating births, but humans still appear to face an especially tight and difficult fit. And that difficulty may have changed our behavior in a profound way. Most animals give birth alone. A mother finds a quiet place. She delivers her young. She cleans them. She protects them. But humans are different. Across cultures and throughout history, mothers have often been surrounded by other people during childbirth. Mothers, sisters, grandmothers, friends, experienced birth attendants. Women who had seen labor before. Women who knew what to look for. Women who knew when something was normal and when something was not. This led anthropologists to propose what is sometimes called the birth attendants hypothesis. The idea is not that every ancient birth had a trained helper waiting nearby. Human history is too varied for such a simple claim. But it suggests that because human birth can be difficult, humans may have evolved a strong tendency to seek social support during labor. Not because humans were weak, but because cooperation was one of our greatest survival tools. Imagine an ancient camp at night. A fire burns low. A woman is in labor. The people around her do not have modern medical equipment. They cannot perform surgery. They cannot solve every emergency. But they are not useless. They can offer water. They can keep a fire going. They can support her body. They can help her change positions. They can encourage her. They can care for older children. They can protect the newborn from cold. And perhaps most importantly, they can bring experience. Experience is not the same as modern medicine, but it is not nothing. A person who has witnessed many births may recognize patterns that a first-time mother cannot. They may know when to wait, when to help, when to call others, and when a situation has become dangerous. For thousands of years, that knowledge moved from one generation to the next. Not through textbooks, through hands, through memory, through stories told by older women to younger women. And that may be one reason childbirth became such a social event in human communities. Birth did not only require a mother's body, it often required a group. But even with support, ancient childbirth carried serious risk. Before antibiotics, safe surgery, blood transfusions, and modern emergency care, complications that are often treatable today could become life-threatening. Bleeding, infection, obstructed labor, high blood pressure, a baby in the wrong position, a placenta that did not separate properly. For much of history, childbirth was one of the most dangerous things a woman could survive. Historical estimates vary widely because records are incomplete, especially before modern registration systems. But researchers agree that maternal death was dramatically more common before effective medical care than it is in many places today. And still, humans continued, not because birth became easy, but because evolution had built another strategy around it. Human babies are unusually dependent. A newborn cannot walk, cannot gather food, cannot cling to a mother's fur like many other primates, cannot survive alone for even a moment. And unlike many mammals, human brain development continues rapidly after birth. In a sense, birth is not the end of development. It is the beginning of a long external childhood. A child must be carried, fed, protected, taught, watched. And that means human survival never depended on mothers alone. It depended on families, on grandparents, on siblings, on food sharing, on people who could help care for children while others hunted, gathered, rested, healed, or gave birth again. This is sometimes called cooperative breeding. And it may be one of the hidden reasons humans survive the cost of childbirth. Our species did not solve the danger by making birth effortless. It solved it by making help valuable, by making care part of survival, by turning a difficult biological event into a social responsibility. That may be the deepest truth hidden beneath every modern delivery room. Childbirth is not only a medical event, it is an ancient human event. A moment where biology, fear, pain, family, evolution, and hope all meet. Our ancestors did not survive childbirth because they had perfect bodies. They survived because they adapted. They used upright positions that worked for them. They relied on experienced hands. They built traditions around care. They learned from each difficult birth. And they carried that knowledge forward. Still, survival was never guaranteed. Every birth was a risk. Every mother who survived carried the future with her. Every newborn who survived entered a world where someone had already fought to keep them alive. So when we ask how humans survived childbirth before medicine, the answer is not that ancient birth was safe. It was not. The answer is that humans did what they have always done when nature presents an impossible problem. They helped one another. Which fact surprised you the most? If you enjoy uncovering nature's hidden secrets, don't forget to subscribe.